While coffee can be a popular and enjoyable beverage for many people, there are certain situations when it may be advisable to limit or avoid its consumption. Here are some instances when you might want to reconsider drinking coffee. 1. Before bedtime. Due to its caffeine content, drinking coffee close to bedtime can interfere with your sleep. Caffeine is a stimulant that can disrupt sleep patterns and make it difficult to fall asleep. 2. During pregnancy. Pregnant women are often advised to limit their caffeine intake. High caffeine consumption during pregnancy has been associated with an increased risk of miscarriage and low birth weight. It's recommended that pregnant individuals consult with their healthcare provider to determine a safe level of caffeine intake. 3. Certain medical conditions. Individuals with certain medical conditions such as acid reflux, stomach ulcers, or irritable bowel syndrome, IBS, may find that coffee exacerbates their symptoms. In such cases, it may be advisable to limit or avoid coffee. 4. Anxiety disorders. For individuals who are sensitive to caffeine or prone to anxiety, excessive coffee consumption can exacerbate symptoms such as jitteriness, restlessness, and increased heart rate. 5. Dehydration. While moderate coffee consumption is generally not dehydrating, excessive intake may contribute to dehydration. It's important to balance coffee consumption with an adequate intake of water. 6. Sensitivity to caffeine. Some people are more sensitive to caffeine than others. If you are particularly sensitive, even small amounts of coffee may lead to restlessness, insomnia, or increased heart rate. 7. Medication interactions. Coffee can interact with certain medications. It's important to check with your healthcare provider to ensure that coffee won't interfere with the effectiveness of any medications you may be taking. 8. Heart issues. Individuals with certain heart conditions or cardiovascular problems may need to limit their caffeine intake. Caffeine can temporarily increase blood pressure and heart rate, which may be problematic for those with pre-existing heart issues. 9. Dependency concerns. Regular and excessive consumption of coffee can lead to dependency and withdrawal symptoms such as headaches, irritability, and fatigue when you try to cut back. It's essential to be mindful of your caffeine intake and avoid excessive reliance. As always, individual responses to coffee can vary, and what might be suitable for one person may not be for another. It's a good idea to listen to your body and consult with healthcare professionals if you have specific health concerns or questions about your coffee consumption.